All righty. So we have a quorum. Thank you so much, everyone. My name is Aurora Archer. I am the CEO and co-founder of the Bellatrix Group, a marketing consulting firm focused on solving problems at the intersection of health, people, and technology. We are delighted to have everyone join us in our inaugural webinar series. And without further ado, I'm going to hand over to my wonderful co-host and partner and co-founder, Pamela.
Hi, I'm Pamela Raitt. I am the co-founder and chief strategy officer of Bellatrix Group. As Aurora mentioned, we're really excited to see all of you, and as folks keep joining, thank you so much for carving time out of your Wednesday afternoon to join us for our inaugural panel this afternoon. We're going to be talking about health and human connectedness today, specifically as it relates to the customer journey. But before I set up just a little bit more context, what I'd love to do is have our four fantastic panelists each introduce themselves. We are super excited to have four folks who are all visionaries in their own right, who also, we have the great fortune of also calling all four of them friends. So love to turn it over. Kiana, if you want to kick us off and have our four panelists introduce themselves to all of you.
Sure. Thanks for having me, guys. And I am Kiana Brathwaite. I have founded the company KB Calls. It's Caring Advocacy and Liaison Services. So I have about 20 some odd years in healthcare, 14 years as a nurse and registered nurse. And I did critical care and a whole bunch of other specialty areas. And what I found was across the board, it didn't matter what the socioeconomic educational levels were. We came to healthcare evenly, right? We were very confused and it's a daunting system. And because it's such a confusing and daunting system, I founded the company to help bridge those gaps. So that's me in a quick nutshell. And I did want to say that you will kind of see, I am home. I'm working in the office, so I'm in the hallway. You might see family like bouncing behind me and everything. So just excuse me being home.
That's the world we live in now, Kiana. So. Ana, you want to go next?
Sure. And with that said of being home, I am in my closet at home because I was trying to get away from my family. So excuse myself if you all are seeing my closet, but it is the only room that's a safe place in my home because the children are not allowed in Anna's closet. So with that said, I'm Ana Lopez. I am regional manager over at Oracle. I just got back to corporate life after a 11-year hiatus. During those 11 years, I was working for a systems integrator from a consulting standpoint, part of the Oracle ecosystem as well. I also ventured out and did what Aurora and Pamela did, started my own consulting company couple months ago, joined a few folks that had left my systems integrator and got them pumped up in doing something different. So I'm still a board member there, but my true calling is here at Oracle right now. And thank you for inviting me, and thank you for having me as part of the panel.
Awesome. Thank you. Thanks, Ana.
I'll go next, I guess. And I want to go on record to say that Anna's closet is actually bigger than my first apartment in New York. I'm Brendan Gallagher. I head up Connected Health Innovation for Publicis Health, which is part of the Publicis Group, one of the largest communications companies in the world. Connected Health Innovation really focuses on transformation for our clients and for us as well. Innovation in terms of helping our clients operationalizing it and really put it into practice, and formalizing partnerships. That's the third piece. So super happy to be here. I'm all things healthcare day in and day out. So this is very passionate about this project.
Fantastic. Thanks, Brendan.
I'm Mike Gadsby. I'm partner, co-founder, and chief innovation officer at O3 World. We're a digital agency in Fishtown. We've been around for 15 years. I suppose that the part of my work that's probably most relevant is we do a lot of work consulting in digital transformation, and a lot of the problems we're seeing sort of the healthcare sector, we deal with sort of regularly, sort of in all other sectors. We do a little bit of work in healthcare and work in innovation in health, but for the most part, a lot of the challenges that we're going to be kind of covering today, you know, we see in a lot of other industries, you know, and certainly at a large level at the enterprise as well. So yeah, thank you for having me. Excited to get into this.
Awesome. And Mike is a dream panelist because you just gave such a great baton handoff to me, because one of the things we're excited about today is that we do have you know, folks on our panel who live squarely 100% live and breathe health, as Brendan said. And then we've got folks like Mike and Anna who also bring a perspective from seeing disruption and seeing change in other industries. And so we're excited to have, you know, a diverse group of people talk about, you know, what are the changes that we're seeing as it relates to health and human connectedness. And, you know, as we mentioned today, we're going to talk about the customer journey. We're going to talk about, you know, some of the evolution that we believe we're finally seeing in health, where, you know, maybe health is starting to embrace the notion that, you know, I as a consumer live and breathe, you know, a full life outside of just the moment that I'm in the doctor's office. And maybe I have other needs and goals and pain points and motivations that could be addressed all along a broader customer journey. And so that's some of what we're going to dive into today. Before Aurora kicks us off with our first question, we also wanted to encourage everybody to please use the chat. We will open up time for questions about 10-15 minutes before the end. But if those questions come up to you along the way, please feel free to put them in the chat, or, you know, if you have something really burning that you want us to follow up with, you know, even feel free to raise your hand and we'll try to keep our eyes on the chat. And if you'd want to use chat again, just to shout out Kiana, as I saw someone did at the beginning, that's good too. All right, so I'm going to turn it over to Aurora to kick us off.
Beautiful. So couldn't be more proud and more honored to have this esteemed panel of thought leaders and thinkers and folks that both, as Pamela said, we know personally are creating a difference and making a change in the respective markets that they serve and in the organizations that they lead. So truly a pleasure. So I am going to kick us off with the first question, which is, what do you think is the biggest challenges for healthcare to better connect people to the services that they need? Go ahead, Miss Kiana.
One of the biggest challenges is just recognizing that we are humans coming to this space, right? As Pamela mentioned before, there's so much that we're bringing to the table. There's so much that we're walking into the doctor's office, the ER, no matter where we're going. And we don't necessarily walk into it interacting with it, because I shared this before, but we have such negative healthcare experiences. I'm sure each of us can pull on something that either has happened to us individually or a family member or something that we watched. And it's just not very human, right? I sometimes feel like when I go into certain things, I feel like I'm on this industrialized conveyor belt where, you know, the person's not hearing me and not feeling me and not seeing me in all that I'm coming to. So I would like to say that we definitely need to put the human aspect back into it. And then there needs to be a recognition of the fact that we do have other things going on, and that when we're prescribed something or when there's a change in our health, that affects us all across the board. So humanizing and recognizing that we are coming to this wholly, and we're very scared and very vulnerable.
Mm-hmm. Yep. Mike?
Yeah, I'll dig into the recognition component of it. I mean, we see this a lot in sort of big industry, certainly, you know, some of the bigger clients we deal with that are trying to hit this challenge. I mean, the bigger challenge you're sort of dealing with is a disconnected experience, right? You're dealing, I mean, they literally call them divisions for a reason, right? And when you see it from that perspective, I think one of the core issues is seeing some of these institutions sort of accept the fact that, like, okay, well, we need to sort of approach this in a different way. What we're seeing as, you know, sort of the addressing the challenge is, you know, whole new organizations that are dealt with just around customer experience, right? But that is at least a recognition of the fact that no one individual at any one department is going to have to sort of deal with that problem. It's really sort of recognizing sort of the division within the organization and then sort of approaching it from that perspective.
Yep. Thanks, Mike. Anna, Brendan, one of you want to take a?
Yeah. I'll take a shot. I mean, I'll I would like to ladder into something, Kiana, you were saying. The human word is really interesting because, you know, the elephant in the room is none of us really like to think about our own mortality. And that is essentially how the system is built right now, is to help fix things that have gone wrong, which is a click in the direction of our own mortality, of our death. So we need to start thinking of these services in much more consumer-centric ways. Mike, to your point, well, the way other industries have really radically centered their product and service design around the consumer in a way that makes it easier to engage and pleasant, right? I think it's easy to point to the system and, you know, the healthcare system and be like, it's an access and an affordability problem. Yes, it is, because you didn't focus it on the, you know, building it around the customer. You know, not to mention the disparities between the haves and the have-nots and the powder keg that had to blow up, that is right now. But I do think that beyond that first click of looking at the monolith of healthcare, we can point to education and incentives as a big piece to answer that as well. You know, even I was just reading the study from Fairleigh Dickinson that just came out last week that said 1/3 of this country wouldn't take the vaccine even if there was a COVID vaccine.
Yep.
Which is just an astonishing failure on education on the system's part to help these people understand what that means. So I think it's a big, meaty, juicy question, and it's why I focus in healthcare, is because there's so many great problems to fix.
So if I could chime in from what I see within other industries, and it goes back to what Mike was saying, that you do see the recognition of many other industries that have formed these customer-centric organizations, and there are so laser focused on this because it is so critical, and not just in healthcare, but across the board, that personalization is very important. Across the board, no matter what industry you are, right? So, and I think social media helped propel that even more, right? So the more, at the end of the day, no matter what industry you're in, the more you feel connected to the service that you're being provided, the more you're gonna navigate to those vendors that you feel connected with, right? So from a healthcare standpoint, I think Kiana, you know, she nailed it, where it's not a fun experience, right? Nobody really wants to go to the doctor unless they have to. But you do see those that click and get it, whereas they're being a lot more proactive. And I follow a lot of doctors online in social media, but they're addressing it from a proactive standpoint. So if you look at the financial industry during the 2008 financial crisis, they had no choice but to go customer centric. They had no choice. And all of a sudden, all these new regulations and everything that they were facing, which, by the way, it's coming into healthcare, because based on what we're dealing with today, there's no doubt the industry has to turn around, right? So this is just forcing that agenda. But I will say that there was a big frenzy during 2008, seeing all the financial institutions trying to get to that customer-centric model. They just had to propel it a lot faster.
Yeah, can I add one more thing to that? So what the interesting part that you're bringing up, and 08 is a great example, right? Where what happened there, which I thought was sort of indicative of what was happening in a lot of businesses, is trust was lost.
Correct.
Right? And trust was lost because you had a poor relationship. And I think that's been the interesting, we talk about being human-centric or customer-centric, right? What you're starting to see at a consumer level is this idea that, you know, we're not here to like serve a product or service. We're here to create a relationship. And the only way you can create that relationship is to build sort of a sense of trust, to really care about, you know, what happens to that customer across that entire journey, and really then focus on solutions based on building that relationship and nurturing it over time.
So you just, sorry, go
Well,
ahead.
I wanted to chime in on two things.
Yeah.
So 2008 definitely propelled the financial industry to become more customer centric. And my hope is for, and I believe we're going to talk about this later, but seeing what's going on with the healthcare system when it's borderline overrun, is definitely showing some of the changes that need to be made. But also, we as the end user, right, because we're the driver of this system, and we really need to understand that we do have the power in that respect. But also, the ones who are making the laws, they don't come at the healthcare system the same way that we do on the bottom level, right? So that's something that also needs to, and I don't mean bottom like we're all at the bottom rung, but the way that I come into the healthcare system and the way a senator or a House representative comes into the healthcare system is very different. So we also need to recognize that. And as recognizing that, acknowledging that, those are ways that we can definitely step into saying, okay, it's not necessarily equal, and how do we start to make it equal, but how do we as the people who are the end user, how do we use the power that we have to have the discussions with the doctors, the insurances, and so forth and so on, that yes, this is what I want, this is what I expect. If I don't get this, I will move on and I will go somewhere else. And you will start to lose that dollar that's coming in and hitting you in your pocket, and you're going to be forced to, as they were in 2008, to do something different. So yes.
Yep. So you guys are all blowing my mind because you just said so many things that resonate so much with a lot of, what Aurora and I've seen and talked about. I want to address a couple things that I heard here in our next question. Everybody here has kind of, I think Brendan called it a powder keg. I think everyone kind of, talked about the other elephant in the room, which is COVID, right? We finally maybe have this watershed moment as it relates to health, and especially as it relates to health and human connectedness, because all of the things that you talked about, access, trust, affordability, personalization, education, so many things, social determinants of health, have been exposed, right? Some of us knew about them all along, but now, if you pretend that you don't understand the disparities in health and the way that the customer journey, as much as it has existed, has prioritized certain members of our society over others, you can't pretend that you don't see that anymore. And then, the other thing that was mentioned that I think is really relevant is when we saw this type of disruption that I think we're hoping for now as a result of COVID, when we saw it in financial services, when we saw it in retail and e-commerce, it was very much driven by consumers, right? It was driven by our dissatisfaction. It was driven by our saying, hey, I'm carrying around a phone all day, like, please make it easier for me to buy a book. It was driven by us. So I'd love to hear each of you reflect on, number one, is COVID going to finally be the powder keg that explodes the whole system and gives us something better, different, new? And secondly, how do we grapple with the notion of, how much power consumers have had in every other industry, in a really complex industry like health, where, certainly people have been dissatisfied for a long time, as you mentioned, Kiana. But I don't know that consumers have ever really felt like we have the same agency and power to lead change as we do in other industries.
So I'm going to take this one, being the non-medical expert in the room. So I will say that as a consumer, COVID has provided something that I think has been very eye-opening, which is the information gathering is not there. The data is not there. We don't trust the data. We don't trust, 1 week we hear one thing, depending what news channel you're part of, no matter where you stand on the political spectrum. The data, I think, as a consumer, you don't trust it, right? So, and that goes back to the human connection. And I think that's critical, because if we had a way that data is trusted, that I have that human connection, and that I can easily access data, which is not political. I'm going to say this again, not political, but data that's telling me these are the facts and these are the real facts, then I would think that would be very helpful. So case in point, I have 2 college girls, 20 and 21, and it's very difficult when you're controlling a 3-year-old versus a 20-year-old on the data that you need to share with them, because this is life or death kind of data, right? Life or death kind of data, where we are making day in and day out decisions, whether you go to the grocery store or not, and this is life or death. So this information right now, it's not readily available. It's available in very different channels. It's very confusing to those of us that are not in healthcare. So that's number one. The second point is, from a technology standpoint, I feel that this industry has really, by no fault of their own, been left behind, right? This is an industry that really needs to grapple with that and take the bull by the horns. And maybe it is COVID, and take advantage of this situation right now, because the ones that are going to be the survivors are the ones that are going to take advantage of that situation. Anybody else is going to be left behind, because guess what? We do have a choice. We do have a choice as consumers, right?
Thank you, Anna. Anyone else want to share some thoughts?
I can. So I don't know if the powder keg, as we talked about, is going to blow it up. I think what COVID is doing, beyond exposing the disparities and the huge inequality within health, because it's so intertwined with those social determinants, right? But I think it's going to allow a crack for disruption. I think there's only two industries out there that have consistently not shown an increase in value. Like, our life expectancy went down last year, over the last 10 years, but the costs have gone exponentially up. There's only two industries out there where that has happened for consistently over 10 years. Healthcare is one of them. Who knows the other one? Higher education.
Higher ed.
There you go. Keith Candone, ladies and gentlemen. So I do think that this pandemic is going to allow for that crack of disruption, and we're starting to see it in places like telehealth. If you had stock in February for Teladoc, one of the biggest publicly traded platforms out there, you'd be up 48% right now. Livongo's stock has been going through the roof, which is a digital health kind of care management platform. So I do think we're going to start seeing some significant changes in terms of how and where care is delivered. And in order for that to be fulfilled and ultimately get to this, outcomes-based payment model or value model, we need to start getting more upstream into those social determinants of health, which will spark a whole new, I think, platform of innovation.
Brendan, can I ask you a quick follow-up question? Because, you were talking about the notion that, and Aurora and I were just talking about this the other day, this notion that there's been no real value exchange, right? The health insurance industry knows everything about me. They know everything about everyone that I know and everybody on this call and everybody all over the world. And yet there's been no value exchange for us providing all of that data about our health. Why have we why is health kind of been the one industry that's kind of gotten like a free pass? Like, you know what I mean? Like, we demand that Amazon I demand that Amazon can get me cat litter by tomorrow morning, but I don't demand that my health insurance company know that I have a 14-year-old son and proactively recommend orthodontists when he's 12, right? Why have we lived with this dissatisfaction?
Because it's only masquerading as a market. It's not a market. It's not like any other industry where my demand drives the products that get built. Like, it's a zero-sum game. We're all going to need healthcare.
Yeah.
When I'm having a heart attack, I don't have the chance to be like, sorry, not liking that experience. Bring me over to the hospital, like 8 hospitals away. Like,
right.
It's parading as a market, and if you break it down even into the cost structures, the person who's taking the product isn't the person who's paying for the product.
That's
isn't
right.
the person who told you to take the product.
Right.
So that breaks the whole consumer power model.
Yep.
That's my thoughts anyway.
Yeah, it's funny, when you hit higher ed, that was like the first thing that came to mind as far as value and the trading of value is concerned. I've been very sort of interested in what higher ed is going to look like over the next year, because I'm like, well, the value exchange just isn't there. If I can't go to a campus, what are you giving me? Like, I couldn't get on YouTube, quite frankly, and there's an interesting dynamic here that I'm seeing sort of traded where, I've been very interested in seeing what private industry is doing around healthcare. You're seeing things like minute clinics spin up and these sorts of things, but that was almost like we got some service over here so we can sort of fit in the model. I didn't think it was like a serious approach to that. I think you're going to see a lot more of that now, because there's an open dialogue about this, and then there's a consumer need, and without all of the regulation and all the crap that sort of sits in the middle. And again, I don't know much about healthcare, but I imagine trying to get some of those people out of the way, the payers and all this other stuff, will help to sort of create the market that Brendan's talking about. The other thing that Ana hit on, which I think is huge, is this digital first approach to healthcare in general. We see it in every other industry, and we talk about digital first as just a dynamic. Like as much as you want to be customer first, you have to be thinking in digital realms. And actually, we're seeing a lot of companies in every industry who are struggling because they are unable to sort of make the transition and live in a world where like data is the product, right? Yep. You asked a great question, Pamela. Like, if you got all that data, why aren't you using that data? Why aren't you giving that back to me? Why aren't you being proactive and predictive? Why aren't you personalizing my experience a little bit better when you have access to all that stuff? And frankly, that I don't even necessarily own it as the consumer. You do as the hospital. Right. So more than anything, you should be giving that some value back to me, right? So I think that's also a dynamic shift that you're seeing here. As far as the momentum I'm seeing and some of the interest I'm seeing, certainly in private industry around a lot of other different things, I think that's the thing. I mean, certainly as a digital agency, I mean, we're benefiting from that because I'm being able to say, okay, well, we got to help people start thinking about what the world looks like in this environment and start really thinking about what they're doing with their data. But the thing about healthcare is they've got a lot of the resources already available to them. I think a lot of this is about structure and change and reorganization to really address it from that perspective and sort of see what happens.
Yep. Kiana, I see you have your hand raised.
Yeah, I wanted to chime in. So there was a couple things. To your point, Anna, to some extent, healthcare has made a decision that the industry itself, that it does not want to move forward, right? This is the way that we've done it. We're comfortable with this and we don't really want to change. The world is changing around us, but we don't really care, right? So there's that piece. Then there's the piece where you have certain initiatives that are coming from board members and administration, and it's really your hand has to be forced in order for some changes to be made. And then with the data piece, our information, what we share, what we willingly share in the digital space is not necessarily the same as what we're willing to share in the health space. And I'll give you an instance. So whenever I've had to go to the doctor, I had an injury a couple of years ago, and every single time, whether they looked at my chart or not, I had to tell the same exact story over and over and over. And it got to the point where in my chart, I was said as I was the angry woman. And I was like, you're darn skippy, I'm angry. You have in my chart, since you're a doctor, a nurse, or whatever, you have to be literate. Did you not read it? And then let's fill in the gaps. But that just is a very small piece of the experience that is happening, where it's like, you have to tell your story over and over again. Now, from the insurance standpoint, the way that the information is being utilized is it's very protective for the insurances. It's not something where, as Mike is saying, as Anna has brought up, and Brendan as well, education is a big piece of this, right? Being able to look through data and saying, 1, this is relevant to me, 2, this is a trusted source, and 3, this is how I need to be able to use this information. It has been so siphoned off and protected from us just to keep them safe that I'm not really sure. We need to take our data back. Like, we really need to say, this is our information, and if you're not going to use it, and if I have to tell it to you every single time, then I need to have my information. And I think one thing that COVID is doing is it's opening our eyes to our experience. It's opening our eyes generally to the gaps that were there, because we have healthcare deserts in the 21st century. That is ridiculous, and it's not something that we should even be dealing with at this point. In one city you have 16 different hospital health systems that you could choose from, and then the other one you have one doctor who's servicing that entire 6 zip codes, and the numbers of people that are within those zip codes. So there's so much change that needs to happen I agree that the education piece is one of the biggest ones. Like we need to have trusted sources that are non-biased, non-political, are not backed by funding, because who says, you know, sugar's bad now and prunes are great tomorrow. You know, we really need to have a foundation there where we can trust the information. And then we need to have our data given back to us, and then used in a way that's going to make sure that when we're going into these systems, maybe we're filling in gaps in the story, but we're not telling our story over and over again, you know, and, you know, you don't have that my allergy is tomatoes when I've never told anybody that, you know, like that whole piece of it. I appreciate the high five, Brendan. And, and then, you know, just all of that is just, how do you fix that? You start having discussions, you start telling people that, you know, you do have the power and you really have to make it kind of look like what it needs to look like for you. And then you force people to understand what your expectations are. And I could go on and on and on.
That's actually a great segue, Kiana. So thank you. You know, there is so much that all of you have shared with regards to core elements that are critical for us to evolve the customer journey within health. And so what I'd love to sort of ask the panel, you know, when we look at these components, whether it's data, whether it's, you know, a customer experience that isn't forcing me to repeat and share the same information with you 10 times along a 3-point or 3-touch journey. You know, Mike, you talked about structural change. I'd love for each of you to sort of take what you believe is one of the core elements and share a little bit about what does it need to look like as we look to evolve this health customer journey.
Well, it's data. It is, I mean, 100 of all those things you listed out, in my opinion, Kiana, I totally agree, it's data. And Anna, to your point earlier, like the incentive structure for any sort of technological innovation in healthcare has always been messed up. Like even if you go back to the High Tech Act, which was during the Bush administration, which actually incentivized the rollout of electronic medical records, you know, it wasn't until phase 3 that they said, oh, maybe these things should be able to talk to each other. Like maybe there should be a common language that we're using from an interoperability standpoint so that we can compare apples to apples for these patients. So I think if we can get that sorted out, that's the key to being able to, Kiana, to your point, to get people that take their data back, which is why I was clapping, because that's the only way we have any power as a consumer is to own that data. It's also, you know, data is the key to a lot of the other things we've been talking about that we need to fix, like all population health measures in terms of driving down the cost of healthcare is all about that data. Personalization is all about the data. Just wait till we get into like genetics and like, you know, whether this medication works for you and your genetic profile, but versus not for you and your genetic profile. You know, if we are fortunate enough to have a couple of vaccines come out in the next 2 years, you know, there's going to have to be some data around, well, this one's 75% efficacious. It doesn't work in these subpopulations very well for some reason, but actually works incredibly well in this population. And who's going to tell that story? Who's going to be the purveyor of that truth? So, you know, if I had to list out, you know, between infrastructure and all those things you listed out, I would say, you know, data and the ability to have a common language would be the most critical piece.
So I'm going to add to that because data-driven analytics is something that I've focused on the past 11 years of my career. And it's something that I am very, very passionate about. I will tell you that anyone who is in today's world that's not basing their decision on data-driven is going to fail miserably. And I will say that, again, no matter what industry, and think about it from a consumer standpoint. How do we make our decisions today when we go purchase something online? It's data-driven, right? We do the research because it's out there. And the same thing will translate to this industry. And I will tell you that the survivors are going to be those that are data-driven. And let's just look at COVID right now. All these different companies that are, you know, fast tracking to get to this vaccine because they know the dollars behind this, right? They know what's going to come up. I mean, it's an economic decision, make no mistake. Nothing here is ever done because they like us and it's our health. It's economics, period, the end. It's business. Business is business and healthcare is business, right? So it's an economic decision. So this economic decision, how do they get to that fast-paced decision of those different algorithms of how does that work? Well, I'm going to put a shameless plug for the organization that I work with, but Oracle was one of the first to stand up and give the US government that information and say, take our big data analytics and start doing those analytics because you guys don't have the infrastructure, the US government. You guys don't have the infrastructure to even get going with the data that you need. So the reason why the first few weeks when all this information was coming at us and we were getting, all this craziness from the media, guess what? It wasn't because these people weren't doing their jobs. It's because they didn't have access to the data.
Right.
Dr. Birx didn't have access to the data, for crying out loud, right? So they were second guessing and piecing together all this information from John Hopkins and all this, piecing together 21st century when we have the ability from a technology standpoint to do this. So I will say I could probably just be here for hours talking about data-driven decisions because that's what's going to drive the key stakeholders in this industry, and that's what's going to drive the profits. And I will tell you, the companies that are going to come out with that vaccine are the ones that are using that data. They're using that data-driven decision-making process to go out there. So I'm going to stop because I'm like Kiana, I can go on for hours.
So go ahead, Mike.
Well, I was just going to sort of tack on it and take a slightly different perspective on it. So data, yes, but I tell you what, we talked to all our clients about data, and we have really serious discussions about data, and they often get pushed under the rug because it's like, data's not sexy. I can't do anything with data. What am I going to do with this? And then they turn into these like giant 3-year, like super, just expensive operational, like bigger, it just suck. So what ends up happening is they end up getting backburnered towards the sexier projects, the things that are going to like immediately drive revenue. And then ultimately what you end up with is just the can that gets kicked down the road over and over and over again, which has been interesting because I've seen a lot of companies who took it a little more seriously a couple of years ago, really thriving right now, versus the ones that are like, shit, we got to take care of this now. Right. So partially I agree that yes, data, but I go back to this concept of sort of rethinking organizational structures to manage this. Mm-hmm. I don't think none of this, like the way the business was set up initially was probably fine for how it was set up initially, but the legacy sort of structure has been carried through, from generation to generation. It just doesn't work anymore. And yeah, you can have a director of digital, or you can have, the certain, IT folks in the middle of sort of managing stuff. But if you don't really have people in place who give a shit about actually doing something good with this stuff and actually making change with it, then ultimately, like you're just not going to end up anywhere. So yeah, I mean, to me, the organizational structure or restructuring, rethinking about how these places sort of work from the bottom up. I mean, to me, that's where the biggest change is necessary. And whether or not that can happen is a whole other thing. So.
Yeah, I wanted to piggyback what Mike was saying because that was perfect. So one thing that I know, I happen to be one of the more flexible individuals in the healthcare space, right? So a change would come in and you would hear everybody go, oh my God, here we go. They're doing it again. There's a change. And there would be so much resistance. There has to be, to Mike's point, some level of buy-in on the front lines where people are servicing all the way up to administration. So the way that this kind of progressed, evolved, if you want to, is it started off as this thing that was supposed to be able to help employees based upon what corporate organizations wanted to provide to their employees. And it eventually morphed into where there's more of this, oh, well, our bottom line, we have to make sure because healthcare is a business, right? And the collateral damage was the people who actually use the system. So data is definitely something that I agree we need to get a hold of, and we really need to start controlling. But also we need buy-in, right? We need that the practitioners and the ancillary staff, we need them to really understand that when they're on the side of being the provider of the service, right? They need to remember being on the side of being the receiver of the service and what that feels like, right? And then say, okay, you know, the reason why we're moving in this direction is because I know as a provider of the service, I don't seek out this service, right? I run from this service as much as I possibly can until I absolutely have to use it. And remember that, but it's so, bottom line kind of business sense driven, that's why a lot of times people in the healthcare space get scared of changing what's coming or seeing the change, because one, we don't like change, but two, it forces us to have to do something different and come outside of our norm. And then three, there's no real buy-in, right? Because it's a decision that's made by administration. It's a decision made by the board. We had no input, we had no say. So there needs to be buy-in from the bottom rung all the way up. And there needs to be some input from the people who are servicing the folks who are coming to the healthcare system.
Yeah. So one of the things I wanted to build on everything that has been shared with regards to how do we solve this problem? What are the core elements? Because ultimately we do want to ask a question on who do you believe is doing it right? But before we get there, there is an observation that I think is intrinsically linked to the services and solutions that companies create. They are not created, for the most part, by the people that they are ultimately serving. And what do I mean by that? And I'm going to be very direct and implicit. You know, I've spent over 25 years of my career operating in corporate America, in 4 distinct industries, and living and working in 5 distinct continents. 9.98% of the time, I was the only female, and I absolutely was the only person of color, meaning Black or Latina. And I will assure you that the way that I asked, and Brendan, you were part of teams that we worked with in the past, Ana, you've been a part of the teams that we've worked in the past, you know, there was a moment in time where as a leader and with an accountability, I started to request, and then I started to demand that the makeup of the teams that were creating services, products, and solutions under my auspice and under my responsibility represented the consumers we were serving, and ensuring that a more dimensional view and experience was being brought to the table. I'd love to get your thoughts on, do you guys see that changing? How do you see your role in vocalizing some of these changes? Because I think that is also a huge part of what we're observing and seeing.
I'll start with this one. So I think you've actually seen some of this start to occur across private industry as it relates to this idea of like being customer centric or human centric means like all humans, right? Like you can't build things that ultimately serve your customers if you don't have perspectives of those people who are your customers. So I find that that's sort of the shift in thinking, and I got to be honest with you, I can't believe that it's behind in healthcare of all places where, you know, what Brendan was bringing up was a great point. Like, you know, you have so much structure in place. It's almost a government service, you know, to a degree. Like it should be more well represented, right? So I agree with that, and I think that there's a drive more now than ever to be certainly more diverse, but definitely just be more representative of the products and services that you're delivering. As far as, you know, our role, you know, as an organization, my role, you know, even as a leader here, I think it's imperative that we take steps and measures to make sure that, you know, I know from our perspective, at least for the products and services we're delivering, I mean, we've made it, you know, huge commitment, particularly, in the last several months, around, really trying to look at our hiring practices, really trying to look at how we sort of engage with our current employee base and sort of, drive that thinking home as well and create a value system that sort of supports that.
Yeah, as the other white guy on the panel, I'm absolutely amazed from myself over the last couple of weeks how open my eyes have become. And I've considered myself a fairly open-minded person my entire career, but I was nowhere near doing enough and being enough to my Black colleagues and friends. Some of the things we're seeing organizations do, not just our own organization, which actually took an entire 2 days off for training for 90,000 employees around the world, which is a significant investment for diversity and inclusion initiatives. But we're also seeing people structurally start to help change things. Like from our pharma clients, a lot of the younger CEOs are coming in and kind of breaking down legacy barriers, like the way things tend to work all the time. I know I've used that phrase corporate gravity with you in the past, which is basically that unseen force that keeps things working the way they've always worked. And just having an awareness of it and being able to openly say, no, we're breaking that. We're doing something different from now on is a huge step forward. So yeah, I think, from our standpoint, one of the outputs of that training was essentially 22 open briefs for our entire employee population around how we can address this head on. And we ended up with something like 7,000 different ideas that now we're filtering through to try and to implement. So including, better paths to leadership. Our company's owned by a French organization, which hid behind a law in France that says you're not allowed to disclose employees' salaries, which is a true thing in France. But they actually went so far as to actually disclose that for everyone in the US, given where we're at right now, so that we can begin at least looking transparently at the discrepancy. So yeah, I think it's a long road, but we are starting to finally see some change. And I'll add one other thing. And the irony in healthcare is that because it's a business model, because it's profit driven, it's been allowed to only focus on people who can pay and who can afford or have private insurance or have jobs that link that their employment to their insurance. And those who don't have been left behind, frankly. And the irony is that a huge percentage of the frontline workers in the healthcare space do not fit into that category. So it just amazes me how much COVID's been exposing this, because here we are taking our hats off to the frontline workers during this pandemic. And the second we turn around, a lot of these hospital systems are furloughing them because the profit centers that they had, which were elective surgeries, aren't getting done. And it's just a broken financial model. It makes you start thinking, like, in a country when 40 million people are unemployed, we're going to have to start disassociating that thought that our healthcare is synonymous with our employment. And that maybe it's a bit of more of a fundamental human right.
Yes. Wow.
Not that I'm saying Medicare for all.
Yes, Brendan, yes.
So, Anna, I know you, I think you had your hand up just to share some thoughts.
So I'm going to take the approach more from the, because I don't think I can follow Brendan on this train of thought and beat what he just said, because amen to what you just said. So and Aurora, you and I know that we've had ample long night discussions around this. So I'm just going to give my thought at this. Has there been change? Yes. Is it enough? We all know the answer. I think the change has started. However, as a female leader, I will tell you, and also Latina, you gave me a spot on the table, but I still don't have a voice. So if I don't have a voice as a leader within the organizations that I've been part of, and nothing done on purpose, right? Just it's just that autopilot. How do you expect your clients to have a voice, right? How is your customer going to have a voice if the people that are in there that have these different thought processes, maybe the rebels, are not given a voice? So again, thank you for giving me a spot at the table, but still don't have a voice, right? And that's been one of my decisions for leaving many of the organizations that I've left, which I've done phenomenally well from a career standpoint, but I still didn't have a voice at the table. Fortunately, where I'm at today, the leadership team that I'm part of very much gives me a voice at the table. But I will tell you, that is something that I think many of us struggle, no matter what race and what orient you have, or sexual orientation, to be honest. It's just, we don't have a voice at the table. So we're saying the right things, but we're not really doing the right things. And I think the events in the past few weeks, which I don't know about you all, but I'm ready to go into 2021, have just completely brought down the curtain on how we view, not just from a social aspect, but also from our day-to-day lives, right? Let's not be hypocritical and say that we're doing this now because of what's happened. What did you do before? And Aurora and I have had some very strong conversations around this. So I think corporations are going to be the last to go there, just because it's such a, monster to turn around. But I think it's on us. It's on people like Aurora, like Pamela, like you, like Kiana, that make that stance and say, time out, right? So it is back on the consumer. So again, how are you going to offer that voice to your consumer and to your customer if you are not giving it to the employees that really deserve that voice?
So one of the questions that we got in, I think
I was
that
going to chime in real quick.
Sure.
Kiana, yeah, go
Real
ahead.
quick. Yes.
Yes,
Okay.
ma'am.
Thank you. So, to Anna's point, and I love the way she says your name, Aurora. I can never say it as beautifully. But to Anna's point, and Brendan and Mike, from my organization standpoint, I sat and watched these initiatives come out from administration without any input from anybody at the table. It was just like they sat in a vacuum somewhere and was like, oh, we should do this because of, the sky is blue and I think it'll work, and there was no input from, as I said before, anybody who actually provided the services. So then when it came down the pike, it was like, they have no flipping clue what this is going to look like. This isn't even the problem. Nobody wants to hear what we have to say. So from the organization standpoint, I am very big on educating my clients, right? And educating the people within my network and educating my circle and educating my community, because the more we know, the better position we are to do what we need to do for ourselves and therefore make changes from the outside in, right? I do recognize that a lot of this is going to come from the outside in because, as Brendan brought up, that gravity, it is just so, it weighs on you. And it to change it, to loosen it up, requires somebody to be open and awake and aware enough to be like, oh, maybe I need to change. Maybe we need to help. What can this look like? And I was reading a study recently that was saying that these initiatives that do come out in the business, I think it was HBR, Harvard Business Review, that was talking about how initiatives, how well they do across the board. So if you force it upon, you're going to have people least likely to engage with it, right? But if you do it as if it's a mentoring type things, or you try different ways and you have them actually engage with the people who want to sit at the table, they build those relationships with the people who want to sit at the table. That's going to make all the difference in how it goes over and how it's going to be accepted and how it's going to be implemented. So I do, from my standpoint, do a lot of education, but I also agree that it's not something that can be forced. It's something that we have to walk into willingly, and it's something that from an administrative point, they need to stop sitting in a vacuum making these decisions about services, and they really need to start saying, if we want to be customer centric, we need to talk to the customer and not necessarily give these stupid, I hate those, what are those stupid surveys where they give you the questions and you have to press gaming. Oh, I hate those, because it's like, no, I really want to tell you how I feel and what I'm thinking, and you have these stupid little bubbles that I have to fill in. It's not giving me an opportunity to really speak to my experience. experience. So.
Thank you. So we're going to ask, because I think each of you has touched on, so how do we empower the consumer? And I think you spoke to data, and you spoke specifically to how media may have, or in most cases did not, sort of empower us. So what are your thoughts with regards to how the media could more effectively support in the education and support in the empowering of the consumer? That's part one. And then part two is, who's getting it right? Is anyone getting it right now?
I'll go first if you want. I think, so, I mean, the big push in my organization, which is a legacy advertising agency, framework, is to help in healthcare. It's different. It needs to be content, behavioral driven content, and not advertising. Advertising isn't changing the behaviors that we want because it's too transactional. It's like buy this or don't. It's binary. Whereas content helps us learn how to do things better. So, our doctor will say things like, hey, it's just diet and exercise, run more, eat less, blah, blah, blah. But that's actually a series of about 1,000 different tiny behaviors. And content can help with that. We make the joke being like, just write a Facebook post or an Instagram post that just shows that you put your sneakers next to your bed in the morning. That's the first step to exercising more, right? Which is a vague concept. In terms of who's getting it right, depending on where you go in the healthcare industry, which is obviously huge. I think Mayo Clinic made some really interesting moves last week when they announced that they will enable all patients with chronic diseases to choose whether they want the standard of care that in their hospitals or whether they want to have that care in their homes. And that's a massive shift for them and cost, frankly, to be able to figure out how they're going to support that level of clinical rigor outside the context of these safe havens that we call hospitals, whatnot. In the pharma space, I'd call out Novartis. Their CEO, Vas Narasimhan, is famous for when he took over the helm. He's younger than I am. It's amazing. What am I doing with my life? But took over the helm and said, in the next 5 years, Novartis will actually be a data science company and not a life sciences company. So that is an output. What they create is an output of their data. Mm-hmm. And then the third, I'll call it a wild card because they're a big client of mine now, and I'm just loving what they're doing in healthcare, and that's Walmart. Walmart has what used to be a huge disadvantage for them against someone like Amazon, which was their brick and mortar footprint, is now where health can happen. And I can say because it's out in the press, but they are getting into healthcare big time, putting in health super centers essentially. And the early centers that I've seen them roll out, some of the stories, like in terms of the access stories, the pricing transparency, you could see a primary care visit for like flat fee of $35 or $40. They're still messing with their numbers. And some of the families that are coming in have never, they haven't given their kids vaccinations. They've never had a checkup. They have access to healthcare where they didn't before. And so I really think somebody like Walmart could come in if they, guns blazing and snap this industry over their knee. But I think those are three examples of folks I think are doing it right.
I have a question for Brendan because I saw that and I was actually really curious about it. So I'm cynical to some degree, and I was like, oh my God, Walmart's going to have all my health data now. But if you sort of connect the dots between health data, my purchase behavior, right? The things that I sort of do on a regular basis, I mean, you're starting to build a little bit more of a profile around a consumer market where you could probably be more predictive and personalized and create something that's a little bit different than me just as a part of the healthcare system. So I did think it was interesting. I'm not sure if you can speak to that at all with what you know, but I'm actually kind of curious on what's happening there.
They've been out talking about it. Like they're the one place where that you can have that holistic healthcare experience, including the social determinants of health. So let's take, 60% of their pharmacy customers have type 2 diabetes. I mean, it's just an astounding number. And now you can walk into one of their health centers as a diabetic and be like, here's the insulin you're going to need. Here's the nutritionist you got to talk to. And come on, let me walk you through the grocery section of the store. And we're going to talk through exactly what it is that you need to be doing from a diet standpoint, from a nutrition standpoint. So they can look holistically across that entire chronic disease and treat it, not just medically.
I was going to say that's great for just from a lifestyle standpoint, because one thing that a lot of patients have had a problem with is having to go to 6 different places, right, to get their information, to get their medications, to see the doctor. So to be able to, I'm not a big fan of big data and all of that, but I do understand how with chronic diseases it can be very helpful, and to have them only go to one place would be phenomenal. So I'm glad that Walmart is doing something along those lines, because they do have the structure and they have the client base and they have the data. One industry that I know has been very customer centric is or patient centric, or just holistic, and this is to Brendan's point earlier about how at some point there is an end of life issue. End of life palliative care has they significantly take into account your situation. What are your wishes? Who's in your family? What do you guys need? How can we support you here in this process and throughout the process? That is one of the industries that I think does it really, really well. And the rest of the healthcare space really needs to look at how, why, when, what are they doing, and how do we duplicate it and do it better, because the structure is definitely there. But palliative care is one of the places where you are dignified, you are respected, and your family and your whole life is taken into account, right? And all of your wishes. So
thank you for that.
Mike, Anna, any thoughts on who's doing it well?
So I'm gonna add on to what Brendan said. I think, and you touched upon something, Brendan. Walmart was one of my customers as well. On the technology side, as was CVS. CVS is another one that's really getting into that market. I think, folks, the disruption is going to come from the private sector. I think it's going to come from the private sector, because the private sector has realized that this is a niche that's not being met. So I think there's several out there that are doing it right. One of them, I believe, is also Amazon. And I think Amazon is going to creep into this before we know it. I mean, if you look at their sales kickoffs, Jeff Bezos hints at this time and time again. He wants you to purchase everything that you purchase from Amazon. And it's a wheel which says, here's how we're going to get to that. And if you look at their statistics, I think what it took Walmart to get to in 20 years, Amazon got to in 5, right? From a purchase standpoint. So I think just as Amazon got into Whole Foods and into nutrition, I think we're going to see them creep into healthcare as well. So there's a lot more to come on that industry. There's stuff that I really can't, I'm not the right person to share, but I think the disruption is definitely going to come from the private sector. I think there's many folks that are trying to do it well. And I think it goes back to the root cause of what Mike brought up, which is the organizational change, because there's a lack of accountability on who owns it, right? So I think while the intent is there, I don't think that they're able to manifest it, because there isn't that accountability across the organization. And I think the organizations that are successful are the ones that accountability is across the board, whether you're in customer service, sales, management, operations. It's that measure that's across that everybody beats to that same drum.
I'll keep this short, but I'll just, so I agree, and I think that's all awesome. I'll just say this, in my observation, we talked to a lot of startups and we talked to a lot of folks looking to disrupt in some capacity or another. And the number of people who are trying to solve this problem is astounding. So there is a lot of energy in the, not even just in the big private sector, in like the startup. I've been in healthcare for 20 years and I'm ready to like blow this shit up and do something else. Like that to me is just an indicator of like, that's where things are going. And I think, you know, Anna, you brought up a good point just to sort of hit on something, which is the legacy and the systems with which you have to tear down within some of these healthcare systems. Quite frankly, just the debt that has been built up in doing that is almost not worth it. I'm just going to say, I mean, it's almost, I mean, I don't know that they have any other choice, but it's like, it's what you're seeing now with a lot of these, you know, upstart financial firms who don't have the 20, 30, 40 years of debt, technical debt, customer experience debt, brand debt, you name it. They don't have to deal with that. So seeing a startup come up that's fresh and clean and doing all this stuff, I mean, I think you'll see some real innovation. I think you have started seeing over the last few years.
Well, yeah, and to your point, Mike, it goes, the infrastructure isn't just the business, right? Like it's the way people become doctors.
Yeah.
It's like you know, it took so long to become a doctor because it used to be really hard to get all that information into your brain. Yeah. And now it's not. So what are we doing about, you know, one of the questions we asked our Walmart client is like, how are you going to get doctors to work for Walmart?
Right.
Like, you know, they're like, well, we'll just build our own medical school if we need to. I'm like, oh yeah, you're Walmart. You could do that.
You can do that, right? Yeah, you may definitely do that.
One final question for all of you that actually came in the chat. What do each of you use? Where do each of you go online to kind of keep up to date on what's happening, you know, both in and out of healthcare, but that kind of informs some of the things that you've talked about today? Maybe you could each just share, you know, the 2 or 3 things that are kind of indispensable for you every day to keep on top of what's happening.
So
okay, go ahead, Anna.
No, you don't, my friend.
Oh, okay. I was gonna say, I don't have 2 or 3. I have like, my inbox is ridiculous. It really depends on what I have going on and what I'm interested in. But I do tend to lean more towards probably a system like Medscape, just because I am a registered nurse and I need to keep up with my CEUs. So I really go into like Elsevier, and they're very technical. That, you know, that's the space that I go into. But I also look at places like Deloitte. They're doing a lot of information on health, wellness, healthcare innovation. And then I'm trying to think. My other one, oddly enough, is Harvard Business Review. And I go there because I get, you know, health information. I get information, you know, that I need as a CEO, as a leader, you know, just as a community member. So HBR has really been one of my go-tos as of late.
Awesome. Anna, jump back in.
Yes. So I was going to say, so I follow, because I'm in technology, one of my favorite sources is Fast Company. It's a very innovative and dynamic a resource online. You can, you know, get the magazine, or you could do it online. I listen to a lot of webcasts, podcasts, sorry. I spend a lot of my free time when I was able to on the road, listen to a lot of podcasts and just follow experts that I believe in from a medical standpoint. I follow Dr. Mark Hyman, who is very holistic, trying to change the food industry and the medical industry from the inside. And he's one of my go-to people, so I always give a plug for him. And from a corporate standpoint, I change leaders that are really disrupting the economies of scale and really disrupting what they're doing. I follow the founder of Spanx. She disrupted an industry, and she comes up with some amazing ways on how she manages her team, how she manages her corporation, how she does her day-to-day communication with her team. So those people that you see that are disrupting the industry are, you know, your go-to. So I do all different kinds of spectrums. I follow these 2 ladies that are hosting because I feel that they're out there trying to do a lot of innovative, answering a lot of challenges for their clients and following a lot of innovative types of disruptions. And, you know, so there's certain people that I look at their social media and just see how they go about their social media. I don't really care what you're eating today. I care about how you're making what you're doing today a better place, right? How you're making it better for somebody else. I think the leaders that are true leaders are, you know, when they're successful, and I say this to my team all the time, if I'm a successful leader, I've propelled you to your next venture in life, right? I've gotten you ready to, kind of like my kids, to go out there. So I'm moving you up. And I don't think as leaders, we do that enough. So, you know, follow those leaders, those people that you see that are out there, that are disrupting and making the noise, and those rebels. But those are a few of the ones that I follow.
Thank you.
I'm 100% TikTok. Just kidding. I don't. I'm kidding. Those are my dance moves, not my health. Digital. And it goes right to the Chinese government. All right, so those are all great sources. I'm going to say Twitter for real, because they actually just made it a lot easier to follow lists without you having to go through and individually curate which ones you're going to follow. Like the digital health list on Twitter usually has some really good stuff. So I'll throw that out there.
Awesome.
Yeah, it's sort of, I agree with that. You know, I don't really have a really cool, awesome answer to this. It's Twitter and Google Alerts, which is, you know, I look for certain phrases and certain terms and certain things like AI and machine learning, and sort of read articles as they pop up. I will say this, because I think he's awesome. There's if you're interested in sort of a really like accessible newsletter, email wise, that comes in that I get every day. It's one called Machine Learnings. Just Google it. You can find it. It's a guy named Sam DeBrule. I don't know if you say DeBrule or like that, but it's awesome, and it's one of these great. I subscribe to a lot of these little newsletters. These individuals who just like provide a bunch of industry updates, but it's great because it starts with awesome, not awesome. So what's awesome about machine learning and AI that's happening, and what's not so awesome? Talks a lot about bias. Talks a lot about, you know, people misusing these technologies in various ways, and I think it's just a really good way of sort of humanizing some of the technology. So the more I can find stuff like that, where, you know, because as much as I love technology, I'm not like an engineer, so like I need people to sort of dumb it down for me. So I appreciate when I can find stuff like that.
Oh, and I'll give an additional shout out to the Rabbit Hole. If you haven't listened to that yet, on it's a New York Times daily podcast, right? Kevin Roos, who's the technology editor at New York Times, did like an 8-part series called The Rabbit Hole around how technology and these platforms, in particular like YouTube's selection recommendation algorithm, has systematically like divided us as a culture. It is really, really fascinating. Nothing to do with healthcare, but it's good on the tech front.
Beautiful. So we are going to wrap up our time together. If anyone has any pressing thoughts or questions, please feel free to enter them in the chat. And if not, I'm going to ask our panelists to leave us with just a final thought. When you look out onto the horizon of what's left in 2020, we're at the 6-month mark today. What do you wish for? What do you hope for? If you could share one thought with regards to evolving the journey, particularly in health, or it can be outside of health. So we'll give you a second to think about it, and leave us with a parting thought for the audience.
Transparency.
Yeah.
Transparency. I'm going to leave you with that one. You can interpret it however you want. Transparency.
Well, I just had a huge thunderclap. Did you hear that?
No.
I'll agree with transparency, but I also, that crack for disruption that I mentioned earlier, I hope that's a real thing. I feel like I've been in healthcare for 20 years now, and I feel like I've felt that way a lot of times. Like, oh, this is it. This is the thing that's going to upend the industry, and it's going to get better for everybody. And I really hope 2 years from now, we can look back and be like, one of the bright spots of COVID-19 was that it exposed the rot, and we stepped up as an industry and fixed it.
Yeah, I'll add some to that. One of the, I'm sure you've seen the meme going around that, and I thought it was, worth mentioning, and people say like, maybe 2020 isn't a bad year after all. Maybe this is the year everybody needed, you know, and it's a pivotal point in the world where, you know, we all sort of woke up and looked at the world a little bit differently and truthfully, optimistically, as I like to consider myself, I do hope that's the case. I do hope that, to Brennan's point, that, you know, that crack is opening not just in healthcare, but across all industries and you know, socioeconomic scales and humanity in general. And I do hope that a lot of good comes from all this when everything's said and done, you know, many years from now.
Thank you, Mike.
Turns out murder hornets were good for us.
What happened to the murder hornets? That's what I want to know. They came and went. Like, I guess they didn't do well in the media or something. I don't know.
Kiana.
So mine is a little long-winded just because of my stance. I really want us to understand that as a whole, we do have power, right? We've deferred a lot when we go into anything that has to do with our health because it seems like such a daunting task. And I love how Brendan brought up the first step is putting the shoes next to the bed, right? But that's a decision that you made. That's your power within being able to say, you know what, my health is worth it. My health is my priority. Now, stepping from my health being a priority, what does that look like? It looks like getting information. It looks like being educated. It looks like understanding. It looks like looking for resources. So just recognizing that you have power, and then you'll be able to move forward from there.
Thanks for bringing us home, Miss Kiana. To Miss Kiana, to Miss Ana, Mike, Brendan, this has been an honor. It's been a pleasure. Loved your energy, loved your thoughts, and hopefully our audience walked away with some new ideas around how we all have the power to change this system. Thank you all so very much for joining us.
Thank you so much.
Thank you for having us. It was awesome.
Great.
Yeah.